Okay. So, equity and outreach and engagement. We know that some demographics, including certain racial, ethnic, and age groups in particular, are underrepresented among registered organ, eye, and tissue donors. One of the donation campaign's goals is to increase the number of registered donors from these underrepresented groups. That's part of our broader expansion of the campaign to help have a bigger net to involve more and more people. This breakout room is focusing on sharing and brainstorming strategies for connecting and communicating with these underrepresented donor populations. I want to encourage anyone who's comfortable to turn on their camera so that we can feel a little more connected. We have a nice small group. And to get discussion rolling, I just wanted to solicit some general history on your OPO's efforts regarding equity. Is this a topic that is under frequent discussion at your OPO? Is it something that you're looking to bring into the conversation? Would someone like to talk a little bit about how equity is a part of your efforts or future efforts? Caitlin K, I see that you're on off mute. Would you like to contribute? No?
I'll start. I'm Kelly with LOPA.
Thanks.
Hi.
Appreciate it.
We actually internally, we added a diversity officer as well as a DE&I employee group. Concentrated a lot on internal training with an external group that was owned by an African-American father-daughter, and so brought all of that in. And now we're participating in the COE with the Communities of Excellence with Baldrige. And so reaching those same internal efforts externally. So it's kind of our beginning start. And then also diversifying our workforce as well. It's been a big push with bringing in a recruiter for staff.
Excellent, excellent. How about any other OPOs? Are you at the same stage, or how are you approaching it? Perhaps I should phrase it as, how is your OPO involving equity in your outreach and engagement efforts? Is there a concerted effort specifically, or is this something that you're looking to develop?
Hi, my name is Tamara O'Connell. I don't know, is there an echo for me?
Sorry.
It's all right. I'm with Gift of Hope in Illinois, and this is only my second year working with the HRSA campaign. My first year was last year. I really enjoyed it. My hospital's got a lot out of it. My hospital partners, I'm in hospital development. And I'm very intrigued by this. I think this would be a fantastic opportunity to include equity and diversity within the realm of donation and transplant. So I think it would be helpful for me to add to the conversation if I had some examples on maybe how has anyone done that in the past. Marley, like, is there a way you could start me off as a newbie, so to speak?
Yeah. So one of the things that we wanted to think about was, what are perhaps, as we've expanded this campaign beyond just hospitals, we're looking at, any and all workplace sectors. What are some specific sectors that would support a more diverse and inclusive donor registries? So looking at what are if we're recruiting specifically workplaces, thinking about what is the workplace demographic of a particular sector, industry, or even just a local location of a business in an OPO service area. So we had pulled some metrics about, which sectors should we be looking at, what can we be focusing on? And we know that, civil servants in general seem to be particularly receptive to the campaign. I think just as, feeling that sense of civic duty. And as it happens, the Postal Service has one of the highest percentages of Black employees. So that would be a great way for engaging more African American donors, potentially. Likewise, corrections officers, some of these civil servant type positions seem to be one of the places. And I know that some OPOs have had great success, not specifically from an equity perspective, but in general, reaching out to law enforcement and getting them involved in the campaign. And so I think that, knowing that that is a friendly community to the campaign, and knowing as well that that can support equity efforts could be, a nice approach. So those are some of the ideas we're thinking about, and we'd love to know what other OPOs and have been thinking about as well, or what partners might have, what ideas they may have, because we know it works better when we have more brains than just one. Does anyone else have thoughts about which sectors or industries, jobs, workplaces would be able to support equity efforts for diversifying the donor registry?
I think the hospitality industry as well.
Hospitality industry, yeah, I think that's a great one. Do you have any existing connections with any workplaces in the hospitality industry already, or is that something that you'd be looking to expand into?
We do network with some of the larger hotels within. I mean, New Orleans is a huge tourist destination, so some of the larger hotels, and try to do more of the health fairs that they put together for their staff. And so always looking to expand that. And boy, wouldn't it be great if you could get involved with the chains at a national level?
Yes. Yeah, we've been thinking about, what are some of the best approaches for bringing in new partners? We've been certainly getting new enrollments this year, but we're still seeing a lot of hospitals, and we're trying to expand. And I think, bottom up and top down recruiting are both really helpful. So being able to get some buy-in at a higher level that then disseminates down to multiple locations can really, support the campaign both in equity and in all ways. For sure. Other industries that people have thought about that would be appropriate for this? I would be especially curious to know, anything that you feel is maybe specific to your state or area that would, and anything that you've had experience with that you'd like to be able to share with other OPOs and ensure that they can learn from your best practices.
We've been also working with historical Black colleges and universities. So.
Yes. Yeah, and I think we've talked about how higher education in general is a great opportunity. So many college students, easy to motivate and get involved in such this important issue, and get them involved in these earlier years, so that it becomes a lifelong mission for them as well. And so certainly historically Black colleges and universities would be a great way of ensuring that we're diversifying that donor registry, while also just reaching out into higher education and making them aware of the campaign.
It also helps on an employment status too, right? So you can hopefully recruit into your organization as well.
Exactly. Great point. Thanks, Kelly.
Sorry, I had to jump off really quick, so I don't know if this was already said, but I'm Madeline. I'm from Gift of Hope, just like Tamara in Chicago. I think a great way, it's not something that I've done yet, but it's something that I would like to do potentially in the future, especially with the HRSA campaign, is reaching out to like our local fire departments, places that have really, really good community outreach that, are really positive impacts of the community. they typically get like a pretty solid following that we could integrate, like a donor registration, with paramedics,
Yeah,
police officers, everything like that, I think would be huge.
absolutely. And just to echo that, I'll say EMTs is another area where we've seen a lot of success when trying to expand beyond hospital, sort of adjacent, but stepping outside. It's a great way to bring in more partners. Great, thank you.
Mhm.
I guess a follow-up question to everyone, not just to Madeline, would be, what are maybe some of the challenges that you have faced or are facing in trying to diversify the donor registry or even your own OPO ranks and bring in, get more communities and more types of communities involved in this, in organ, eye, and tissue donation?
Yeah, I'll say a challenge that I found specifically at my hospital, I have University of Chicago Medicine. There's a pretty large challenge in the African American community because historically, some research hospitals have experimented on African Americans. So just the trust level within itself is not high, just in the whole medical community. So when you add organ donation kind of on top of that, it can be very challenging to break that barrier. While the hospital itself and organ donation, obviously we've been working on building more of that trust, it still presents itself as a challenge.
Has anyone else been experiencing that same issue?
We do in Louisiana for sure. The Tuskegee experiments are still very prevalent in the families that we approach. They're not that far removed. So their uncles or their great uncles were actually involved or have relatives involved. And so, yeah, that mistrust it's alive and well. And I almost think it's been amplified because of COVID as well.
Yeah.
And so we're seeing a lot of that having to just start over and rebuild and things that we had made some headway on in that trust factor of being in the community. COVID really kind of took that right back again. And so it's almost like starting over.
Right. Would you be able to expand just a little bit on what it looks like when you're feeling that resistance or seeing more trust? What are the engagements like that you're experiencing that create that sense of, okay, we're not getting that trust?
For actually approaching families in the hospitals, our staff have encountered the you just moved my loved one here so you could take their organs conversations, which were not as prevalent as they have been in the last 18 months. And because some of our larger hospitals are transplant centers, and so they have higher level of care. And so we're starting to see that.
Okay. How are our breakout rooms already ending? This is bizarre. So I guess one of the things we'll want to think about is what the donation campaign can do to support these efforts. What else might you need from us in order to feel like you can help build that trust, or anything that we can do? I don't know if anyone has any burning requests. I know that these breakout rooms are going to be closing shortly already somehow, but we can definitely continue this discussion in the main room and solicit some more ideas from these people in the other groups. I appreciate you all kicking off the conversation here. I think this room will close in about 1 second.